Very good evening, everyone. Thank you, Chairpersons, for inviting me. Thank you, Dr. Biswas sir, for giving me this opportunity, the recurrent opportunity of being in BD1. So, to begin with obesity, let me just come with a fact. The energy produced by sun in 1 second is 6.5 billion times more energy compared to what humans spend in 1 year. So that is car, flights, ACs, industries, all energy which humans consume in a year is 6.5 billion times lesser than what sun produces in a year. So what is the context of this here in this obesity meeting? So we know though obesity is a multifaceted, recurring and relapsing disease. There are multiple factors which are responsible for obesity, but one simple factor is more consumption rather than expending. So with research, we now have molecules which are used in diabetes which can decrease this energy or calorie consumption by humans and thereby address obesity by targeting one factor of obesity. Surmounting obesity with Tirzepatide is the topic that I have been given, and these are my disclosures. Dr. Manushpati Parwa sir has very elaborately discussed about the roles of GIP and GLP-1 in human physiology, its role in glycemic reduction and its role in obesity reduction or weight reduction as well. So GLP-1 and GIP combination is the molecule Mounjaro or Tirzepatide which we have here. That is the dual agonist, and we previously had GLP-1 receptor agonist which is a single agonist. So how is it better? Because we give two molecules, we give two agonists in a single molecule. So we can use a higher dose of GLP-1 at the same time not have the amount of nausea which a very high dose of GLP-1 receptor agonist would bring about, with additional reduction in body weight and additional reduction in HbA1c as well. So there are a number of trials which have been done with Mounjaro or Tirzepatide in obesity, SURMOUNT-1, 2, 3 and 4. And these trials are very interesting. SURMOUNT-1 was done only for obesity without diabetes, for weight management, and that was studied in around 2,500 patients over a 72 weeks period. SURMOUNT-2 was weight management in individuals having type 2 diabetes. Now, we know when it comes to obesity and weight reduction, lifestyle modification is one of the cornerstones in reducing weight. But then it is very difficult to maintain the reduced weight at that level with just lifestyle modification alone. And that was studied in this SURMOUNT-3 trial, where individuals in two arms were given lifestyle modification for a period of 12 weeks, and one arm was continued on lifestyle modification and the other arm was given injection Mounjaro, and it was seen that the weight reduction management was far better in the Mounjaro arm compared to the arm who continued on lifestyle modification alone. So that was SURMOUNT-3. SURMOUNT-4 was weight reduction management. That is what happens when individuals who are on Mounjaro, like this is a frequent question. So, doctor, how long do I have to take this injection in order to reduce my weight? So SURMOUNT-4 actually studied this question. They studied patients who were given Mounjaro for a period of 1.5 years, and then they were followed up for another 6 months to 1 year, and the increase or decrease in weight when Mounjaro was continued vis-a-vis when Mounjaro was discontinued in the group of patients was again seen. The difference was seen, and we'll come into that. And finally, SURMOUNT-5 was a head-to-head comparison of Tirzepatide, Mounjaro in obesity compared to the maximally tolerated dose of semaglutide in another arm. So first of all, we go to SURMOUNT-1, which is the role of Mounjaro in patients with obesity who do not have type 2 diabetes. So only for obesity they are giving this. And what happened? So in this there were again three arms. In one, 15 mg of tirzepatide was given. In another arm, 10 mg of tirzepatide, and in another 5 mg of tirzepatide was given. And these three arms, these three group of patients received different doses of tirzepatide were compared to placebo arm. So the grey is the placebo. And what were the results at the end of 72 weeks? So interestingly, weight reduction started at 4 weeks after initiation of Mounjaro in all the three arms, be it 5 mg, be it 10 mg, be it 15 mg. And with the lowest dose of Mounjaro, now we know Mounjaro 5 mg is available in India, unlike 15 mg, which is the maximally tolerated, maximally prescribed dose of Mounjaro. And even with 5 mg of tirzepatide, weight reduction was seen, began as early as 4 weeks, that is just after 4 shots of Mounjaro, and around 16% average weight reduction was seen at the end of 72 weeks. The results were even better with a higher dose. So with higher dose, that is 15 mg of Mounjaro, at the end of 72 weeks, around 22.5% average weight reduction was seen. So that is a huge figure. 16% at the end of 72 weeks with just 5 mg and 22.5% with 15 mg Mounjaro at the end of 72 weeks. And weight reduction starting early. So in the study, the graph, as you can see, they begin separating after 4 weeks itself. So we get early results. When you look at this slide, so more than 5% weight loss, we know metabolically significant or metabolically meaningful weight loss comes around between 3 to 5%. So when you look into how many people lost more than 5% weight loss, which is considered to be meaningful weight reduction, with the 5 mg dose, approximately 90% of the individuals lost more than 5% body weight with 5 mg dose. When you look into more than 5 mg weight loss with the 15 mg group, almost 96% out of 196 individuals lost more than 5% weight loss was there with the 5 mg group. When you look into the figures, so more than 20% weight loss is somewhere it is considered to be where you have a remission of diabetes and other diseases. So 20% weight loss is considered to be a very good weight loss when you are talking about metabolic diseases, reversal or remission of chronic lifestyle diseases. So there was 31% patients with 5 mg Mounjaro who had more than 20% weight loss. And in the 15 mg group of patients who were receiving 15 mg of Mounjaro, almost 62% of the individuals had more than 20% weight loss. So that is a very good figure, very good statistics. 9 out of 10 patients achieved more than 5% weight loss with 5 mg tirzepatide, which is currently available. And 3 out of 4 patients achieved more than 10% weight reduction with tirzepatide 5 mg. And these were all patients who had obesity without diabetes complicating the picture. Almost 2 out of 3 individuals who received tirzepatide 15 mg lost more than 20% weight loss. So we talk about bariatric surgery, which brings about a weight loss of around 25%, maximum 25 to 30%. And we have an injectable agent which is to be taken once a week, which brings about weight reduction, almost more than 22% weight reduction with 15 mg of Mounjaro given once weekly, which is comparable to that of bariatric surgery, the results achieved via bariatric surgery. So we have weight loss, and that was seen in SURMOUNT-1, and then they evaluated with a DEXA scan to see how much weight they lost as lean body mass or muscle mass, and how much they lost as fat. And surprisingly, what they saw was that there was more of fat mass loss compared to muscle loss, and even more interestingly, most of this fat mass was lost on the abdomen, that is the visceral adiposity was at rest. So we have a molecule, a dual agonist, which was 783 participants in the study, and 783 patients, they received Mounjaro for about 36 weeks, and they had minus 21% weight reduction. Now, half of the patients were continuing with Mounjaro for another 52 weeks, that is 1 year, and half were taken off Mounjaro. And what was seen, that patients who continued with Mounjaro, they continued to have greater weight reduction. So at week 36, the weight reduction was minus 21%, and at week 88, the participants who were 21% at 36 weeks became minus 26% leaner compared to what they were at 36 weeks. But unfortunately, the patients who were taken off Mounjaro, as you can see, they regained back that weight, but it is not equivalent to what they started. So when we continue with Tirzepatide, we continue to have weight reduction. So it helps in management of weight reduction. So maintain the weight reduction, but when we discontinue Mounjaro, patients tend to gain some percentage of the weight loss again. The adverse events were not dissimilar between GIP-1 and GLP-1 dual agonist Tirzepatide compared to GLP-1 receptor agonist, and the most common adverse events were again related to GI adverse events. There were no serious adverse events, and the adverse events, discontinuation due to adverse events were similar between semaglutide and Tirzepatide. In fact, with semaglutide, the more number of patients numerically discontinued from the study compared to Tirzepatide. And so to summarize, we see that Tirzepatide is a molecule, is a dual agonist of GLP-1, which we already had, and it was combined with GIP. And it was seen that this dual agonist Tirzepatide significantly reduced the body weight by an average of 16% with the lowest dose, 5 mg, which is available, and 22% with 15 mg dose. Tirzepatide maximally tolerated dose. The challenge is to get GLP-1 to their highest dose. And so even with Tirzepatide, with the maximally tolerated dose, there was superior weight reduction compared to semaglutide maximally tolerated dose, 21.6% vis-a-vis 15.4%. There were also improvement in the key cardiometabolic parameters like blood pressure reduction, reduction in LDL, reduction in triglyceride, improvement in HDL. And the most common adverse reactions, fortunately, are the ones which we are already aware of. That is the gastrointestinal side effects, which are mild to moderate in intensity. And the key with Tirzepatide is, again, like any other GLP-1 receptor agonist, to start with a lower dose and gradually up-titrate over months, over each month, to a higher dose. We can start with 2.5 mg, which is available, and then go up to 15 mg, which is the maximum dose of Tirzepatide that is currently available. In India, however, we have 2.5 mg and 5 mg of Tirzepatide alone. But fortunately, the silver lining is the fact that even with 5 mg of Tirzepatide, there was 16% weight reduction, which was higher compared to 1 mg of semaglutide. So with that, I thank you for the patient.